Next we'll be discussing acne vulgaris. Acne vulgaris, that is the most common type of acne. If we talk about the etiopathogenesis of this condition, increased androgens, there is role of interleukin, that is increased interleukin 1 alpha activity. So interleukin 1 is involved, and there is decreased linoleic acid. Due to all these factors, what happens? There is hyperproliferation of keratinocytes in the duct of sebaceous glands. So hyperproliferation of keratinocytes in the duct of sebaceous gland. Let us consider this is the sebaceous gland. This is the duct of sebaceous gland, and the duct is lined by these keratinocytes. On the inner side you might find sebocytes. Sebocytes, they secrete sebum, while these keratinocytes only line the duct. So what is happening? Hyperproliferation of the keratinocytes. So due to this hyperproliferation, more and more keratinocytes are proliferating, and what will happen? Blockage. So there will be blockage in the duct of sebaceous gland. Now once blockage occurs, what happens? The sebocytes are still secreting sebum, and more sebum is collecting. So increased sebum collection. One term is also used for this, seborrhea. So increased sebum collection or seborrhea. Now this sebum is a very good culture media for a bacteria. So when there is excessive sebum, there is increased proliferation of a bacteria, that is Propionibacterium acne, simply P. acne. And once there is proliferation of this bacteria, what happens? This bacteria releases lipase enzyme, and this lipase converts triglyceride which is present in sebum to free fatty acid. And what does free fatty acid do? It causes inflammation. So many a times these lesions, they become inflamed, red in color. Okay, so these are the factors which are occurring from beginning. If you remember, first these are the changes, that is increased androgen, increased interleukin alpha 1 alpha activity, decreased linoleic acid, due to which hyperproliferation of the keratinocytes, blockage occurs, more and more sebum start collecting. There is increased proliferation of P. acne, and then lipase enzyme converts triglyceride in the sebum to free fatty acid, causing inflammation. Now during this pathogenesis, various types of lesions might also start forming in the skin. And how the patient presents clinically? Clinically, various types of lesions can be seen in acne, and that's why if you want to use one term for all these lesions, that one term will be polymorphic. So lesions of acne are polymorphic. Poly means multiple, morphic means morphology. So multiple type of morphological lesions can be seen. These lesions can be comedons, which are the most characteristic lesions of acne, or they can be other lesions in the form of papules. Because there is bacterial proliferation, they can cause pustule formation. Sometimes they increase in size, become nodules or cyst. Now comedons are the most characteristic lesions of acne, and these comedons can be of two types, open and closed. Open are also known as black comedons, while closed are also known as white comedons. Let us try to understand. Let us consider that this is the opening of the sebaceous duct. If it is not lined by the epithelial lining, that is, there is disruption of epithelial lining, this keratin gets exposed, and due to this exposed keratin, it gets oxidized, and due to oxidation it appears black in color. So these are known as open or black comedons. But sometimes there is an intact epithelial lining over them, due to which they appear skin colored or white, and these are closed due to intact epithelial lining. These are known as closed or white comedons. Okay, so comedons can be of these two types. Now, as I told you, there are multiple type of lesions. Lesions are polymorphic. So depending on the type of lesion which is mainly present in the patient, you can grade them. Okay, so this is the grading of acne. So there are different grades like grade 1. Now we call it grade 1 if the lesions are, so you have to look at the lesions. If the lesions are mainly comedones. So if the lesions are mainly comedones, it is grade 1. If the lesions are mainly papules, it is grade 2. If the lesions are mainly pustules, it is grade 3. But if the lesions are nodules or cyst, sometimes abscesses, then it is grade 4. Okay, so you can see that which is the most severe among them, grade 4. So grade 4 is the severe type of acne where nodules and cysts are seen. So this is also known as nodulocystic acne. So if they ask which is the most severe type of acne vulgaris, answer will be grade 4 acne or nodulocystic acne. So here you can see these comedones are the very small lesions, and these lesions, if they have disruption of the epithelial lining, they appear black in color. So if you find these black lesions, these are black or open comedones, also commonly known as blackheads. While if they are having intact epithelial lining, they might appear skin colored or white in color. So these are whiteheads or white comedones. Like in this patient, you can see that these white or closed comedones are present. So since the majority of the lesions are comedones, this is grade 1 acne vulgaris. While in this patient, you can see mainly papules are present. So papules are solid raised lesions which are less than 0.5 centimeter in size. There are few pustules also, like you can see this one is pus-filled lesions. So this one is also pus-filled lesions. So pustules might be present, but majority of the lesions are papules. So this is grade 2. While in some cases the acne is very severe, where you will find these large lesions like this cystic swelling or nodules might be present, like you can see in this patient. Okay, so along with various other lesions, like there might be comedones, there might be papules, like you can see there are few papules here, but you can see nodules and cyst, big nodules, cyst and abscesses are present. Okay, so this is what? This is nodulocystic acne, grade 4 acne. This is severe type of acne. So among these 4 grades, the most severe one is grade 4 acne. Now if we talk about the treatment also varies depending on the different grades. Okay, now before discussing the treatment, let us also write down few other variants of acne. So most common is acne vulgaris. Okay, but there are other variants also, like neonatal acne. Neonatal acne occur due to the maternal androgens which are passed on to the neonates. So this is due to maternal androgens. Then infantile acne. Infantile is due to increased DHEA. So what happens that the immature adrenal glands of the infant start secreting more of DHEA, due to which these type of acne lesions might be formed in the infants. Then senile acne. Senile acne, as it is very obvious from the name itself, this is commonly seen in old individuals. So due to solar elastosis, due to excessive photo damage, what happens in old age, they start developing these comedone like lesions over face. These are known as senile acne. Acne fulminans. Acne fulminans is associated with systemic features like fever. So not only the acne lesions, but this is so severe that systemic features also develop. Then acne conglobata. Acne conglobata is considered as the most severe type of acne. Most severe. Okay, so among acne vulgaris, most severe is grade 4, but among all the variants of acne vulgaris, the most severe is acne conglobata. Okay. Then acne excori. Acne excori is commonly seen in females suffering from OCD. Like you can see here, this is a neonate suffering from neonatal acne. Okay, so with age they will generally resolve within few weeks, but actually why they develop? Because of the maternal androgens which have passed on to this neonate, and they start developing these acne like lesions over their face. Now these are senile acne. You can see these black cometon like lesions which are present near inner canthus and over the cheeks. Okay, so these are due to old age, solar elastosis, and the damage which has occurred to the skin over many years due to photo damage, etc. What happens? These senile acne develops. Acne fulminans, you can see this is again a severe type of acne, and this is usually associated with systemic features. This is acne conglobata. Acne conglobata is the most severe type of acne, and you can see that there is grouping of the lesions, and not only the face but the other body sites are also involved, like trunk, back, extremities. So this is the most severe type of acne. Then acne excori. It is very obvious from the name itself, excori, excoriation. Okay, so why these patients are excoriating the lesions? Because they are suffering from OCD, and all of you might have read about OCD in psychiatry. The patients who are suffering from OCD, obsessive compulsive disorder, they have obsession, they have a thought process in their mind which is continuously going on, like washers. They think that their hands are always dirty, so they keep on washing their hands every 15 minutes. Okay, similarly checkers, they think that the doors are open, so they go and check, then again after 15 minutes they think that they are open, so they again go and check. So there is a continuous obsessive behavior which is seen in these patients. So similarly in these females who are suffering from acne excori, they are also obsessed, and they are obsessed with an idea of what? They are obsessed with an idea of picking these acne lesions. So whenever the acne lesions start developing, they pick them. So by the time they present to you, you won't find any acne lesions because they have excoriated all the acne lesions. So what you will find? Only excoriations. So no acne lesions are present, only excoriation marks are present. So wherever these patients have excoriated, there these marks are left behind. Okay, so only if excoriation marks are present, the whole face is excoriated because of this habit of theirs, what happens? This is known as acne excori, and there along with the treatment of acne, you need to counsel the patient also. You have to tell the patient that you have to avoid this picking, otherwise again and again these excoriation marks will be formed. In the variant, you can write down one more, that is drug-induced acne. Okay, so drug-induced acne, as it is very obvious, is due to drugs, and they are also known as monomorphic acne. So I told you acne lesions, like in Acne Vulgaris, they are polymorphic. Different types of lesions are seen together. But if only single type of lesion is seen, then it is known as monomorphic acne. This is generally due to drugs. So this is also known as drug-induced acne. Like in this patient, you can see over the back, over the trunk, and over the face, only papules are present. No comedones, no pustules, no nodules, no cysts, only papules are present. So lesions are monomorphic. So monomorphic acne are also known as drug-induced acne because they are generally due to drugs. Like in this patient, you can see there is moon-like facies, okay, and patient might have gynecomastia, and these papillary lesions might be present over trunk as well as face. So this is what? This is drug-induced acne due to steroids. Okay, so steroids can also lead to drug-induced acne or monomorphic lesions. So you can write down the drugs which can cause drug-induced acne. One I already told you is steroids. Steroids are the most common culprit of drug-induced acne around world. Second is OCPs. These are the most common cause in Western countries. Third is isoniazid. This is the most common cause in India. Other than these three, it can be due to lithium, iodine, phenytoin. So there are different drugs which can cause drug-induced acne. Among them, the first three are very important. Steroids are the most common cause around world. Then OCPs are the most common cause in Western countries. Then isoniazid is the most common cause in India. So many patients who are taking ATT, anti-tubercular therapy, they might present with these monomorphic eruptions, which are monomorphic acne, also known as acneiform eruptions. They look like acne, acneiform, look like acne, but they are not acne. They are what? They are drug induced. Then other causes can be lithium, iodine, phenytoin. Now let us discuss the treatment. So I told you there are different grades depending on different type of lesions. Okay, so based on grading, you can treat them. Like if it is grade 1, that is mainly comedones are present, then what you can do? You can simply treat it with topical treatment, like topical retinoids. Examples: adapalene, tretinoin. But if it is grade 2, so if it is grade 2 acne, then along with these topical retinoids, So along with this typical retinoid, that is adapalene and tretinoin, you need to add topical antibiotics like clindamycin, you can also use benzoyl peroxide. This is plus minus. Sometimes if there is pustular lesions, then you can add benzoyl peroxide. If pustular lesions are the majority of the lesions, that is grade 3, then along with this topical retinoid and topical antibiotic, that is clindamycin and benzoyl peroxide, you need to add oral drugs as well, like oral antibiotics, oral doxycycline, oral minocycline, or azithromycin. So because majority of the lesions are pustular, there is a lot of propionobacterium acne infection, then oral antibiotics are to be added. If it is grade 4, then the drug of choice is oral retinoids. So oral retinoids is the drug of choice for grade 4, that is nodulocystic or severe type of acne vulgaris, that is isotretinoin. Isotretinoin. Okay, so remember, isotretinoin is the drug of choice for grade 4 nodulocystic acne. So many times this question have been asked, what is the drug of choice for grade 4 acne or nodulocystic acne? Answer is isotretinoin. So these are various drugs which are to be used. Now there are a few important points which you need to remember about these drugs, like side effects. Doxycycline can cause photoonycholysis. So doxycycline is a group of tetracycline drugs and they are known for photosensitivity. So sometimes what happens, due to excessive sun exposure, they might develop photoonycholysis. That is onycho, nails, lysis means separation. That might occur due to excessive sun exposure. Then minocycline. Minocycline can lead to hyperpigmentation of not only skin but sometimes as well as nails. So once this question came that which of the following drug can lead to melanonychia. Melano means darkening, nychia means nails. So answer was minocycline. Then third is isotretinoin. Now isotretinoin is the drug of choice and it can lead to so many different side effects and it is important. So we are going to discuss the side effects in detail. So before discussing the side effects, you can remember that isotretinoin is the drug of choice and the dose which is used is 0.5 to 1 mg per kg body weight. Duration of therapy. See, there is no fixed duration which is mentioned in the books. That is, nowhere it is written it has to be given for 2 months, 3 months, 4 months. But there is one point which is written that you can continue isotretinoin till the cumulative dose. Okay, so till cumulative dose of 120 to 150 mg per kg body weight is reached. So this is the end point. You should not go beyond this. So the total cumulative dose from the day 1 to the day last should not be more than 120 to 150 mg per kg body weight. Now the side effects. The most common side effect of isotretinoin is a dryness of lips. So this is considered to be the most common side effect. Almost every patient who takes isotretinoin develops this dryness or chapping of the lips. Then it can cause hypertriglyceridemia. Hypertriglyceride. So triglyceride level increases. Hypertriglyceridemia. This is hepatotoxic drug. Because it is hepatotoxic drug, before initiating the therapy, you should ideally do LFT. It is teratogenic drug. Because it is teratogenic drug, always exclude pregnancy. If the patient is female and pregnant, you should never use this drug. It is a teratogenic drug. It can cause pseudotumor cerebri. Pseudotumor cerebri, that is benign raised intracranial tension. So patient might present with headache, that is due to raised intracranial tension. Now remember that because there are few more drugs which can cause pseudotumor cerebri, you should avoid concomitant use of those drugs. So if you are already giving isotretinoin, you should not use those drugs which can precipitate pseudotumor cerebri, like hypervitaminosis A. So you should not give vitamin A supplement to these patients. Similarly, tetracycline. Tetracycline can also lead to pseudotumor cerebri, so you should not add tetracycline along with isotretinoin. Then if they ask you which is the most severe side effect of isotretinoin, the answer is DISH. And what this DISH stands for? It stands for diffuse interstitial skeletal hyperosteosis. So DISH is the most severe side effect. So most common is dryness of lips, while most severe is DISH, that is diffuse interstitial skeletal hyperosteosis. This is very important that this drug is teratogenic, so should not be used in pregnant patients. Okay. Now, in one of the exams, this question was asked regarding to the teratogenic side effect of isotretinoin. So remember one important point, that systemic retinoids. So isotretinoin is also a systemic retinoids. So systemic retinoids are teratogenic. Now there are two important systemic retinoids which you should always remember. One is isotretinoin and other one is acetretin. Both are systemic retinoid, both are teratogenic, both should not be used in pregnant patients. Okay. Why they are important? Because this is drug of choice for nodulocystic acne, and this is a drug of choice for pustular psoriasis. Okay, so both are drug of choice. So this is drug of choice for nodulocystic acne, this is drug of choice for pustular psoriasis. So they are used, but you should not give during pregnancy. Now, what happens with these systemic retinoids are that once they are consumed, they start accumulating in the fat. Okay, and once you stop taking them, they are slowly released from there. Okay, so once you stop taking the drug, still there is drug in the fat and it can cause teratogenic side effects. So after stopping the drug, also there is a period when the drug can be teratogenic. Okay, so like if you're giving isotretinoin and the patient wants to become pregnant, then what do you have to do? You have to stop isotretinoin. Now, not just stopping isotretinoin is required, as well as you need to counsel the patient that the drug will still be there in the body and it will take some time to completely wash off. Okay, so that period is also very important. So remember that isotretinoin should not given during their pregnancy, as well as 1 month after stopping the therapy also patient should not conceive. Okay, so this period, this wash off period for isotretinoin is around 1 month. So patient should not conceive during the therapy as well as 1 month after stopping the therapy, and this period is for 3 years in cases of acetretin. This is so long in acetretin. Why this is so long? Because this drug gets esterified in the fat and it requires around 3 years to completely wash off. So this period is also very important. Okay, so this was the question which was asked in one of the exams. Okay, so remember, for isotretinoin it is 1 month, for acetretin it is 3 years. So let us discuss one question which was asked in JIPMER. The question was that patient is taking isotretinoin. For how much duration patient should not conceive after stopping the therapy? Okay, and we all know that the duration is 1 month. So patient should not conceive for 1 month, but the options were 3 days, 3 weeks, 3 months, 3 years. Now what will be your answer? 3 weeks or 3 months? The answer is 3 months and not 3 weeks. Why? See, it is 4 weeks that the drug is teratogenic. Okay, but 4 weeks is not there in the option. The options are 3 weeks and 3 months. So there is no harm in extending this duration to 3 months, but there is harm in reducing this duration to 3 weeks, because if the patient conceives in the 4th week, then the drug is teratogenic and it might lead to teratogenic side effects. So there is no harm in extending the duration. Okay, so always choose the higher duration if such question is asked. So answer was 3 months and not 3 weeks.